Welcome to the series of videos which focus on the speaking section of the OET test. In this series, we'll be focusing on giving you tips which will help you improve your score in the speaking section.
Good morning.
Good morning.
Could you please confirm your full name and your profession?
My name is Divya Menon and I'm a nurse.
So what's the greatest skill as a nurse?
I feel empathy is my greatest skill as a nurse. I'm very sensitive to my patients' needs and I want to give them everything that they need to recover quickly. I feel that this is an important skill for every nurse.
So what advice would you give to a nurse who's joining your team?
Well, I would say that the shift time that they have, those 8 hours that they are spending in the hospital are very important. And they have to be on their toes. And one single mistake could leave them a lifetime of regret. So I feel that they should not take anything easily or on a lighter vein because it's a matter of life and death.
Let's do the role play. I'll be the interlocutor who will take on the role of a patient or carer of a patient, and you'll be the nurse.
Okay.
So here is your role play card and a paper to make some notes.
Okay.
You may also seek any clarification if required. So you have 3 minutes time to prepare. Yes, time starts now.
Okay. Thank you. Good morning.
Yeah, good morning, sister.
Could I know your name, please?
So what's the problem here? The nurse asked for the name of the patient. The patient was already admitted into the ward, so it becomes the responsibility of the nurse to know the name of the patient. When you're attempting the speaking test, check for the name of the patient either from the role play card or check with your interlocutor.
Yeah, my name is Julie Robert.
Hi, could I call you Julie?
Yeah, sure, you can.
Yes. So Julie, how are you feeling now?
I'm feeling a little better, sister, but there's something that's really bothering me.
Oh, what could that be?
I'm a little concerned about when I can be discharged.
Oh, well, you can only go home when you're fully recovered and when the doctor says yes.
Yeah, but I know that the doctor said that it's only a minor fracture. So I thought I could be discharged as soon as possible, so because I have a few commitments.
I know that the surgery is very minor, but knee injuries are very tricky. So they usually take more time to recover. So I think you have at least a week-long stay left in the hospital.
A week long is too much.
I understand what you're saying, but it so happens that if we now hurry this process, then we might have problems later on. You might also have to come back to the hospital, or the recovery could take even more time, or could this lead to a new injury. So we would want to avoid all this. So it's a good idea to rest for this week, at least 7 days.
Is there any possibility that I could be discharged home within a week, because I have my exams in the next month and I have very less time left to prepare? And one more thing I would like to add, I've been preparing very hard for my semester exams, so I don't want to take any chance missing my exams.
Oh God. I know that exams are important and I totally understand that you've put in so much effort. Yes, there is a possibility that you might be discharged a little early, especially if you take your medicines on time and you don't miss any prescribed medicines, and also make sure that you don't hurt your knee further. Moreover, you would have to do a lot of exercises. You could be looking at exercises such as hamstring contractions, quadriceps contraction, or even partial squat contraction.
Can you guess what went wrong here? Well, the nurse gives too much of information without pausing or without checking if the patient has really understood it. This is an error in the clinical communication parameter that is used to evaluate your OET speaking.
A physiotherapist will come and help you. You would have to listen to him or her and make sure that you follow his or her instructions. Only after this and looking at the movement of your knee, we can decide if you can be discharged or not. So if you do all this on time, maybe we can be looking at an early discharge.
Okay, considering my present situation, I'm really not sure whether I would be able to do these exercises that you've just suggested.
Well, don't worry. A physiotherapist is going to be with you. He or she will guide you. Initially you'll be dependent on them. They'll also give you a walker to help you with the exercises, and over a period of time you will be able to do this all by yourself. And I've seen a lot of people recover, so you don't have to worry about it at all.
So how much time do you think will it take for me to completely recover and walk normally.
A walk normally is going to take a little longer than 7 days, of course. Although you would be discharged, we would want you to continue these exercises at home. Maybe you could have a person, your friend or anyone from your family to help you and support you initially. But later on, in about a month or two, you should be all right and you'll be able to walk all by yourself.
Okay, thank you, sister.
Now, the speaking section ends abruptly. The nurse fails to ask what is called a deliberate question, which is asking if the patient has understood all the information or if the patient has any further concerns.
Good morning, Miss Julie. How are you today?
Good morning, sister. I'm feeling a little better, but I have a concern now.
May I know what's bothering you?
Yes, sister. I'm a little concerned about getting discharged as soon as possible because I have a few commitments.
I understand that, but you can't go home without recovering completely. We can only go home when the doctor discharges us, can't we?
Yeah, I do understand that, but having said that, I really think that I have very less time for my examinations. I have my examinations the next month and I have very short time for me to prepare. And I've been working very hard to clear this test in this semester because I have plans of going abroad. So I don't want things to get delayed.
I understand what you're saying. It so happens that knee surgery is a very tricky surgery. Although it is minor, it still takes a lot of time to recover. We can't further this process anymore. So it's very, very important that you take rest and you give it its due time. And I think it'll take you another week.
But a week is too long, I think.
So from what I'm understanding, I see that you are okay with your recovery process, with the surgery, but your only concern is going home early. You just want an early discharge. Am I right?
Yeah, that's right. But I would like to add one thing more.
Yes, please.
I would want to know if something could be done which can help me in speedy recovery.
Well, first, I would want to tell you why it is important that you stay here for 7 days before I answer the second question. The recovery is important so that we do not extend the injury further, so that we don't have any more complications in future, and that your mobility, your agility is not affected in any way. So that's the first reason. To answer your second question, can you go home early? I feel medicines play a very, very important role. You need to make sure that you take all the prescribed medicines on time as given. This will ensure that you recover very fast.
But I would also like to know if there are any exercises that can help me in recovering better.
Well, yes, you could. We could use exercises to help in your recovery. A lot of hamstring exercises can be done. Do you understand what hamstrings are?
No, sister.
So hamstrings are a group of muscles that extend from your hip and they help in the flexing of the knee. They're very important for your walking. They also protect your knee and your hip joints. These exercises will help you recover fast and you will also be able to walk all by yourself. Any other question that you might have on this?
Yeah, sister. I'm a little concerned whether I would be able to do these exercises because I'm still experiencing some pain, So I'm not sure whether I would be able to do these exercises suggested.
Initially, you may not be able to do these exercises all by yourself, but we will always assign a physiotherapist. A physiotherapist will come down after lunch. Today, he will explain all these exercises to you in detail. Over a period of time, you will be able to do them all by yourself. So that confidence will come after your physiotherapy sessions.
Okay.
Right? And once you go home, you can also continue doing these exercises at home to strengthen your muscles. And any other concerns, Ms. Julie?
Yeah, as I said, I have my exams in the next month and I have very less time to prepare. So would it be possible for me to utilize my time here to do some study?
Well, you could study, but I wouldn't recommend it right now because sitting in the same position for a very, very long time is not advised. You need to flex your muscles and you need to rest as well, because it is a surgery after all, however minor it is. So I would say please use these 7 days to recover so that you can zealously study after you go home.
Okay, that sounds good.
All right.
Yeah.
Okay. So any other questions that you might have?
As of now, that's okay.
Okay.
Yeah.
Right. So let's wrap it up then. And please relax, Ms. Julie, and I'll come back later to have a look.
Yeah, that's fine, sister. Thank you so much.
For more such easy tips to crack your OET test, join our sessions. If you really like this video, we'd love for you to subscribe to our channel, and not just that, we'd love for you to share it with your friends and anyone who's preparing for the OET.